Good morning, everyone, and thank you for joining us today as we celebrate Black History Month by honoring, restoring, and protecting Black health. My name is Lorraine Lathan. I am the founder and director and president, of Jump at the Sun Consultants. We are a firm that's dedicated to addressing health disparities and improving health outcomes in Black and low income communities. Historically, Black individuals and families have been burdened by health disparities rooted in structural racism and injustices. The disproportionate impact of the COVID-19 pandemic on Black communities is just the latest reflection of these inequities. Traditionally, we have turned to each other to get through these hard times. One historic example of this is how, when denied access to quality health care and advanced medicine, we pass down home remedies amongst ourselves. Those traditions passed down by elders and our community sages helped us gain knowledge on and build bridges between people who hold different views. It's important that we preserve that legacy and that wise people, caring activists, and others remain dedicated to supplying wisdom, advocacy, and support to members of the community village. This is how we take care of our own during a public health crisis. But there's a threat to that crisis, the dangerous spread of health misinformation on social media. False claims, hoaxes, and flat out lies on Facebook, Twitter, and Instagram that put us all in danger. So before turning it over to Edgar Mendez, who will moderate the panel, I'd like to honor the women of the Lathan and Anderson family, women who were daughters of former slaves, some who actually worked as sharecroppers on the very land that their ancestors worked. They later migrated north and began the tradition of protecting their loved ones in the absence of access to public health and advanced medicine. So today, I honor these women and the many other women who have tended to the health and well-being of their families in spite of Jim Crow and structural racism. So with that said, I will turn it over to Edgar Mendez, who will introduce the panel and moderate the panel.
Thanks, Lorraine. Good morning, everyone. It's an honor to be here today with over 140 guests and our amazing panel. I'm sure everyone's excited to hear from them, so I'll go ahead and start with the first question and allow them to introduce themselves. Just so you know, I'll call out each panelist when it's their turn to answer. So our first question, you'll have 2 to 3 minutes each to answer this one. Please introduce yourself and share how your current and or past positions have helped you honor, restore, and protect Black health.
Hi, everyone. Good morning. I am Dr. Michelle Robinson, and I am the director of the new Office of Health Equity here at the Wisconsin Department of Health Services. When I tell people about who I am, I like to tell them that I am the daughter of working class Black folks. I am the daughter of a sharecropper. My mom worked the fields in Louisiana. I'm the first generation to move out of Texas. I'm a Southerner, and also I am a daughter of a family that has been disproportionately and heavily burdened by negative health outcomes. I lost my mom at the age of 21 when she was only 52. And I have lost many aunts, many cousins, many uncles, and even my sister who is suffering from an autoimmune disease herself. And so I tell people that I like to share that bit of story because everything that I do is rooted in my personal historiography. I have had the pleasure of being able to study sociology, and I enter into this work from a social science background. Before we called them social determinants of health, we call them inequalities. And so most of my work experience and my academic history has been around trying to understand what are those root causes of health outcomes when we're talking about our governance structure, our economic systems, our social arrangements, those types of things. More recently, I've had the pleasure over the last, let's say, 15 years or so, to work in a couple of positions within the state of Wisconsin, starting with the Race to Equity Project, which was a place-based disparities initiative aimed at addressing racial disparities between African Americans and white folks in Dane County. I moved from that after 7 years of working with that project and ended up in government. And that has sort of led me to this inaugural position that I am in today, where I have the privilege of both helping increase DHS's capacity in addressing inequities, both in its workforce, its internal workforce initiatives, but also related to our programs, service delivery, and all of the things that we do on behalf of Wisconsinites from across the state.
Thank you. Dr. Hanson?
Good morning, great morning. It is a pleasure to be here among all of you. I am Dr. Diamond Hanson, and I have the immense pleasure of serving as the Outreach Program Area Manager for the COVID-19 Response and Recovery Team, which is a part of the Wisconsin Department of Health Services. So again, thank you for having me. To answer the question, for me, my parents purchased our first family home on 48th and Locust in the early 2000s. I had the opportunity to see when the street sign went from green, and then 6-7 minutes up the road, it turned to blue. So in the Wauwatosa area, how that determined your health, right? So I saw that if you went up the road just 7 minutes, right, that kind of put your whole scheme of health in jeopardy. So when we talk about health disparities, I knew I wanted to get right in front of that. 48th and Locust, if you all are familiar, is in the zip code of 532-110. It is a zip code that has some of the highest sexually transmitted infections, crime, and teen pregnancy rates in the nation, right? And I came from that. So from that experience, I after high school, moved to Washington, D.C., went to Howard University, studied maternal and child health education and biology. Again, being in that environment and seeing some alarming health disparities as it related to STIs. And I'm like, what is going on? Okay, I was at home, I saw this, moved to DC, saw this. So then that led me to Morehouse School of Medicine in Atlanta, Georgia, where I got my master's in public health. Again, some of the same alarming high statistic rates in health disparities. To be honest, I had no intention on moving back home. You know, I said, when I go off to school, like, that's it, I'm not going back home. But life happens. I came back home. And before I started my doctoral program, I said, you know what, if I'm going to do this thing called public health, you know, in Georgia, in DC, and I'm going back home, I want to be a leader of public health in my own community, addressing those very disparities that I saw across the nation. So for me, that is what has helped me really honor, restore, and protect Black health, because I feel obligated, especially as a millennial, they say, as a young public health professional. I feel that is my obligation to continue educating and helping to educate generations before me and after me.
We're happy to have you back in Milwaukee.
Mhm.
Dr. Zapata?
Yes. Whew, this is a very heavy question, and I'm just so honored to be here today to be a part of this conversation. As I've been reflecting on this question and just reflecting on Black History Month, one thing that I always think about when we have these conversations is during the time when there were enslaved people, there were severe punishments for enslaved people learning how to read and write. one of the punishments would be getting your fingers cut off, getting severely beaten. And then if you were white and caught helping an enslaved person learn to read or write, you could get a monetary fine or in trouble. But if you were an enslaved person, it was so severe, you could get your fingers chopped off, get severely beaten. And the reason that people were so fearful of enslaved people learning how to read and write was because they might realize the situation that they were in. They might learn about their freedom. They might learn about things that could help them ultimately become free. And I look at over the years, over the generations, how we are still facing as a Black community, especially American descendants of slaves, we are still facing many of the ripple effects of that time. And so that is impacting our history of being enslaved, our history of discrimination, our history, all of that history has caused there to be trauma even within our bodies that last over generations. And we're seeing that even right now. So when we talk about this topic, when I think about my grandmother, whose great-grandmother was a slave, and I think about that and I just reflect of how serious a role that I play in my generation line for honoring, restoring, and protecting Black health. This is a very, very serious thing. And so I could talk about this a long time because it's a very, very special topic to me. But the ways that I do that is in everything that I do, personally and professionally. I am on a mission to do this very thing. I knew ever since I was 5 years old, I wanted to be a medical doctor, and I stuck with that. I am now a medical doctor. I am board certified in pediatrics and also preventive medicine and public health. So every time that I run to a delivery, every time that I work to do research, to look into root causes that are causing birth inequities and birthing outcomes, I'm honoring, restoring, and protecting Black health. In my role as Chief Medical Officer for Community Health at the Wisconsin Department of Health Services, I'm doing that same thing as well, advocating at the highest level for ways we can change policies, ways that we can advocate for change in all areas so that we can do this thing. And even outside of my medical and public health roles, I find ways that I can honor, restore, and protect Black health by doing everything that I can to eliminate the racial wealth gap so that I can educate young girls about health and prevention and wellness. So those are just some of the ways that I do it. And ultimately, my goal is to help provide education and empowerment. So in the same way that those enslaved people were taught not to be able to read and write and communicate with each other, I love communication. I love doing anything that I can to fight for equality and justice. So that's a little bit of my background and how I'm doing it.
Amazing. Thank you all for what you do. So for the second question, or the following questions, everyone will have 1 minute each to answer. So can you kindly share a time from your personal or professional life when a home remedy or medical information or misinformation was passed on to you through your family or social networks? What made you trust or distrust that information, and did you pass it on to others? Dr. Hanson?
I'm going to be honest. This was a question that I thought long and hard about. And I'm like, oh, okay, this is a good, hard question. Let me just first say what I love about this panel and Dr. Zapata and Dr. Robinson is, first of all, they are an inspiration to me. And second of all, I really appreciate how we all have different backgrounds in terms of medical doctor, prevention, research, academia. And that actually plays into my response for this question. Because I am prevention and leadership based, I still, let me be very clear, trust the science, trust, my physicians and medical doctors like Dr. Zapata. But I know a personal time, I actually had COVID for about close to 2 months. It was about a month and a half, some time ago. And one of the things that I heard in terms of home remedy was taking sea moss and elderberry, and that would help, you know, your symptoms of COVID suppressed and all of those good things. Now, I will say, and again, I trust the science. I trust the medicine. I am fully vaccinated. At the time that I had COVID, I was not vaccinated. So did I take the elderberry and the sea moss? Absolutely. Did it help me personally? Absolutely. I trusted that because of who it came from. But did I pass it on to others? I did. I did share, you know, this is what works for me. You can try it, see if it works for you, but get vaccinated. So I want to be very clear that, you know, my passion for public health and prevention, along with trusting the science and trusting our physicians to tell us what is working, worked in that personal situation.
I got the moss from Mr. Dye. Dr. Zapata?
Oh, this is a good one. We get to share our personal stories, right? And we can be real. Is it okay if okay. I didn't want to talk about this one because it's a little bit of a touchy subject, but put me in the chat or say it's okay in the chat if I can get real and tell about mine. If I see at least one or two people, it's okay. It's okay. Okay.
Okay.
So I'll be really real. One of the biggest things that was passed on, I grew up in very, very, very close with church. My grandfather was a pastor. He passed away when he was 90 years old, and he just retired from preaching like 2 years earlier than that. He was a pastor his whole life. That was a big part of my upbringing, and faith is still a huge part of my life now. But one of the things that was passed on a lot, just in general in the faith community, not everyone, but passed on a lot, was that you don't have to go to the hospital. You don't have to see the doctor. You don't have to take medicine because God's going to heal you. Your faith is going to heal you. You don't even have to go. You're going to get a miraculous healing. Don't go to the doctor. Don't take medicine. Just stay away. And that was passed down for a lot of generations and passed on. And when there would be multiple people, as I was a young girl, remember, this was put me in a lot of conflict because ever since I was 5, I wanted to be a doctor, but yet I'm around a lot of people who are like, you don't need the doctor, you're going to be healed. Faith is all that you need. And then I would go to church and there were certain people, key people I remember who did not go to the doctor, got cancer diagnoses, diabetes diagnoses, and said, I'm just, you know, I don't need medicine. I don't need anything. I'm not going to the doctor. And then being at their funerals, like, this isn't making sense. And this is really touchy because I am a woman of faith and I'm not afraid to say that. But it was like, this is not right. There's people dying, but yet faith is so important as well. And so that was something that's passed down. And I guess what I would say to that and what I have learned, one of the scriptures that always stands out to me is faith without works is dead, where you can have that faith, but how do you know your answer to your prayer might not be me? As a Black medical doctor in the trenches doing research, being the one that runs to that delivery, saving babies' lives. When I think about Dr. Corbett, who is a Black woman researcher that helped develop the Moderna vaccine. And when I think about so many others, it's very important to reconcile those two things. And so that's one of the biggest things that was passed down, as far as, I don't know if we want to call it misinformation or just a different viewpoint. And it's a very touchy subject. So I didn't even want to bring it up, but y'all said I could be real. So that's one of the things that I've seen. And I love I go all the time now doing a lot of like COVID outreach conversations right alongside pastors where we talk about how do faith and medicine coincide. But let me tell you, if you're wondering, I know that I am an answer to prayer, the research, the science, the cures that we do have. Sometimes that could be the answer. So I'm going to stop there before I stir up too much. Let me mute my mic before I say too much. That's my real answer. Thank you for asking that question.
Go to church, go to the doctor, and take your medicine. Dr. Robinson?
Dr. Jazz, you are not alone. I definitely had the same struggles with family where it was church over medicine, over faith, or rather faith over medicine, over healthcare. But there were two that I wanted to lift up, which are slightly different from what Dr. Diamond and Dr. Jazz has already raised. And one is garlic. My dad taught us that you can take raw garlic instead of blood pressure pills. And unfortunately, my dad's belief that he could self-treat his high blood pressure led him to be hospitalized in 2019 with an aneurysm and a stroke. The second thing is around sunscreen. So that Black people don't need sunscreen, that we don't burn, that we don't get skin cancer, of which we know all as beautiful as our melanation or deeper levels of melanin, because all people have melanin. Some of us have higher concentrations of it. As beautiful as it might be, we can get skin cancer. In fact, I think there are quite severe disparities in skin cancer among Black people, partially in response to the fact that we don't have this awareness that we can and should be using sunscreen to protect ourselves from UV rays.
Thank you for that information. So I'll go on to the next question. How has health misinformation, especially during the COVID-19 pandemic, negatively impacted Black communities? I'm going to start with Dr. Sabata.
Great question. Oh, there's so much misinformation out there, but I would say one thing that I hear a lot of things, but one thing that I hear is like the vaccines have microchips in them and the government's going to track you. There's been some misinformation about that when you get a big one, when you get the vaccine, it's just giving you COVID. That's a big misinformation. And then just general distrust of that there's some ulterior motive for why we're encouraging the vaccine. So that has definitely caused a lot of, there's many reasons that people are hesitant, and for justified reasons, just looking at our country's history. But the thing that I always say is that the things that happened in the past were real, they were not right. And I validate that was true, but we're in a different phase now. We're working to heal, we're working to rebuild. Even if it's been hard to trust us in the past, please do it now, because this is a life or death situation. So that's what I would say is some pieces of misinformation that have been impacting our community.
Thank you. Dr. Robinson?
Yeah, so I would say that the impact on our community has been that we have experienced more suffering and more deaths than we had to. That is the cost of the righteous concerns that we have, the distrust that we have. I think this is one of the challenges of this, is that it really sort of highlights the pernicious nature of racism, because I think oftentimes we think of racism as a thing or a system or individuals acting on people. And racism also manifests in just our general distrust, where we have a system, we have solutions, we have things that can actually help us be healthier, treat disease, survive a pandemic, and we don't know that we can trust them. And so we make choices that are actually in contradiction of what would be best for ourselves and for our collective health.
Thank you. Dr. Hanson.
Yes, this is a good one. Whether you subscribe to the idea that there are those among us that are still physically combating generational trauma, I think we can all agree that many people of color, African Americans, really face multiple health issues, and those increased comorbidities impact us daily, even when we're not in the midst of a pandemic, right? So even if COVID were just a cold, and for the record, I am not in no way, shape, or form saying it is just a cold, but if it were, just like an unexpected bill that can push a household living month to month to the brink of homelessness, the introduction of this pandemic to our already fragile health ecosystem has really devastated a lot of families, mine included. I've lost loved ones to COVID. We have to remember that we are not all starting from the same place. So when we talk about health equity and, Dr. Robinson's lane, like, we have to really name that and understand that we're not all starting from the same place. And we don't have the luxury of just giving credit to memes or celebrity tweets that tell us to avoid the vaccine or implore us to wait and see if COVID will directly impact us or our families. But we do know that any, fantastical story or group text that we're on, or social media posts that we see or that we're sharing, has sowed a seed of doubt and caused a family member to wait and get the vaccine. Or it has shamed someone for wearing a mask that has led to some devastating result. So I hope that answered the question, but just to put it into context of how just health misinformation in general just negatively impacts Black communities and communities of color. And oftentimes, again, I feel like I'm in a unique position because I am a younger public health professional, right? So I look at, people that I went to high school with and college with, and, you want to kindly tap them on the shoulder and call them out to say, hey, that's not right. Like, I am okay with putting myself out there and being looked at crazy, if you will, for combating misinformation. I have no problem doing that, because I can't just turn the blind eye that I don't hear it or I don't see it. So that's what I have for that question.
Thank you. So how can we help Black communities overcome the distrust in the healthcare system and make critical information more available? And I'll start with Dr. Robinson.
Didn't know I was going to go first this time. Oh, wow. So, I think that one role is the role we're playing right now, right? Like, increasingly, while there's still a lot of work to be done as far as diversifying healthcare professions and health policy and those types of things, we've come a long way, and there are increasing numbers of Black folks in these positions. And I think part of what our responsibility is to be both those translators, to be those trusted actors, and to also bring our community in. And that requires us to stay connected to our community, to help demystify what is often complex, bureaucratic, and sometimes nonsensical systems that are not necessarily best structured to support trust, right? Like, there's a lot of transparency issues. There's a lot of things around, like, things not making sense, like lots of people got frustrated or are frustrated around the pandemic guidance and like the process of updating information and science and all of those things. So I think one role is increasing in continuing to work on the diversity in these fields, and also making sure that we are leveraging our roles and responsibilities and connecting and being good stewards and translators to our communities. I think the other thing really is that we as Black folks in our communities, we have to challenge ourselves. So there is education, right? And so some of it, and I know that you all are gonna talk a little bit about a model in a few, but like, we have to be able to assess what is good information and also engage with that information. I like to tell people, I don't care about being right. I care about doing the right thing, right? And so, and that's, to me, that's the basis of science, right? It's about, it doesn't matter what my personal beliefs are in this moment. If information comes that prove something better, if it's going to get us to that goal, then that's the information that we are going to focus on. And so helping our communities understand and lean into that culture, it's a little bit uncomfortable. It's a little bit, you know, we all are wanting to have stability and to feel grounded. And so this back and forth and this sort of wave in which information passes can be just an uncomfortable thing. So I think we all have to kind of lean into grounding ourselves and being comfortable with that process. And I do think we have to continue to give ourselves a chance. And whether that is like actually going to your PCP, you can't build a relationship with your doctor if you don't show up to the doctor's appointments, right? And I think also, like, I'm, you know, completely aware that all PCPs are not equivalent. All doctors are not Dr. Jasmine. Like, and so, you know, knowing that there are options, right? That if you encounter a doctor that isn't a good fit, that we all have the right to choose a different doctor. And part of that work should be continuing to show up and saying, like, let me meet someone else. Let me talk to someone else. Let me get some recommendations from my friends and from my family members.
Thank you. Dr. Hanson?
Yes, so conversations like this are so important because it isn't just health literacy that needs to be increased in order to positively affect these health outcomes and the health disparities. We must really continue to increase media literacy, including social media, political literacy, financial literacy. And I know we're talking about money, but that is a big thing that impacts health, and health literacy, right? Because we know that none of these segments exist as sector silos, but that each of those elements and components are really interconnected and really impact folks' behaviors and daily living of members in our community. I think that there is so much, it's really important that we really teach our community members to advocate for themselves. And I realize that we often hear this phrase, and it may not look the same for others, because this whole idea of self-advocacy looks different for different organizations in different situations. For example, it's tough to really ask those questions, and some people think of it as exposing their ignorance to some professionals or authority figures, but it's really more important that you hear or get access to the information that you need. Be a journalist for yourself, be a catalyst for yourself. Don't just rely on Google. You know, ask your healthcare provider, ask Dr. Zapata. She is always making herself available. You know, it's okay to ask who, what, when, where, why, and how, right? Who is the expert? Who has my best interest at heart? How did this come to be? How did you reach this conclusion about the vaccine or my diagnosis, or which vaccine I should get? You know, when should this happen? What's the side effects? All of that good stuff. Why did you prescribe me this medication or this treatment plan or this care plan? What is the expected outcome, right? So those are legit questions that you should ask your healthcare provider. No question is a dumb one. And I think that we also, lastly, have to remember not to just wait on the medical establishment to self-repair us or to save us. I know that there are many working hard individuals that are really trying to reduce the health disparities that exist and address those systematic biases that can impact care. But in the immediate, we all must teach one another how to advocate for ourselves and for our families, because if we don't, who will?
Thank you, Dr. Hanson. Dr. Zapata?
Mic drop after, I don't even have to say anything after that. But I guess I'll still say something, but those were some amazing, I agree with everything Dr. Robinson, Dr. Hanson said. One thing I would say from a clinical standpoint is just emphasizing again the power of trust building and relationship building. In order to have trust, in order to trust someone, it's more than just having credentials. So a lot of times people will say like, oh, we are, we work for this big name public health agency, or I have a white coat, I am a doctor, so people should trust me. Or we are highly educated, we have this degree and that degree and that degree. Guess what? That is not enough to get people to trust you. People need to know that you are credentialed or need to know that you're knowledgeable. But in addition to that, they need to know that you're someone who's reliable. You've been there, you're currently there for them, and you're going to be there for them in the future. And then finally, for people to trust you, they need to know that you are safe. They need to know that they are safe, in physically safe, but also safe in the conversation. So just because you have a degree, just because you have a white coat, just because you work for a high name agency, it doesn't matter. You need to show up. We've been showing up in communities, and we're so interested now in ways to support the Black community, ways to eliminate inequities and focus on COVID outreach and building trust. But where were we years ago? Were we still in the same way that we're showing up with all this money and supplies and enthusiasm to partner with these community-based organizations now that we're in a pandemic? Were we showing up when they were having fundraisers and barbecues and things before this happened? When the pandemic dies down, are we still going to be there? Oh, again, you might need to make me mute my mic because I'm just going. But it's more than just the credentials. We have to show up. We need to show up, and even after COVID dies down, we need to continue to show up for not just the things that are in our benefit. So for example, as a researcher, I partner with communities, and I want to show up when I get a grant or when I'm doing a research project. But when that grant is done, am I going to still show up when they invite community members to the church service to honor us? Or am I going to show up to the picnics and celebrations? You need to still show up and be there. So that is a huge part of trust. It's not just your credentials, it's being there. And then also it's making sure that people feel safe with you emotionally and physically as well. So when you're having these conversations, are you making people feel stigmatized? Are you making them feel stupid or bad for not getting the vaccine or going to the doctor? Or are you making it a welcoming and a safe space to have that conversation? Also, one more thing, touching on the healthcare system, people want to feel safe physically. And when we know that there's implicit bias within the healthcare system, and there's that actually leads to disproportionate deaths among certain backgrounds, we need to fix that. We need to fix that bigger issue so people feel safe even coming into those settings. So overall, those are some of the things that are really important as we some would say rebuild trust, some people will say build trust in the first place. And then finally, it's just important to partner with trusted messengers. So who are the people that community already trusts, whether it is having a conversation about COVID with a basketball coach. Me and the basketball coach come on the basketball court and we're talking to kids about health and wellness, whether it is going and singing music together and then talking about it, whether it is partnering up with pastors and doing collaborations, whatever it takes, partner up with trusted messengers to rebuild this trust. We're all in it together.
Thank you so much for sharing. We're going to move into a quick and powerful 30-second call to action. I'm going to start with Dr. Hanson.
Okay, I'm gonna try this. So one of my favorite quotes is by Mahatma Gandhi, and he said the best way to find yourself is to lose yourself in the service of others. So I wanna first say thank you to Jump at the Sun and Miss Latham, who I've known since my days at the City of Milwaukee Health Department, for hosting this wonderful event. To Dr. Zapata and Dr. Robinson, again, it is a pleasure. It is always a pleasure. I learn so much from each of you every single day. This has been an amazing conversation, one that is absolutely necessary and so important for the overall health of our community. I am ardent about this work and the impact that it has on our community at large. I tell you all today to be encouraged, stay encouraged, and keep up all of the amazing work. Keep having these necessary conversations, keep advocating for one another, and keep advocating for yourselves. We may be cautiously optimistic regarding the current COVID trends, but we know that there is still work to be done to eliminate biases in healthcare for an increased health equity for the community. So thank you so much. It has been a pleasure to serve and to be here today. So thank you.
Thank you, Dr. Hanson. Dr. Zapata?
Yes, my call to action would be just echoing the amazing, amazing comments from Dr. Hanson. To everyone, stay encouraged. We are moving in the right direction with seeing our COVID case numbers going down, but we're still in a pandemic. We're moving in the right direction though, but we need to stay on our guard. We need to continue to wash our hands, have our mask on, stay safe, get vaccinated if you are eligible, still do those things to stay safe, because even though the counts are going down, even one death among anyone in here or anyone in our families, that's too many. And so I want everyone to stay safe. So keep up the good work with keeping up public health practice. The other thing, please, call to action, take care of your social, emotional, and your mental well-being. There are many people that are predicting that the second pandemic is getting ready to be a wave of unprecedented mental health concerns. When you talk about post-traumatic stress syndrome, we can't even heal from that right now because we're still living in the trauma. And so once COVID passes, there's some predictions that there's going to be a lot of increased mental health, overdoses, different issues. We're already seeing suicidal ideation among teen girls go up. Our overdose rate in Wisconsin is up 34%. Take care of yourselves and check on someone else. Check on others and check on yourselves every single day. Be kind to yourself. And then the last call to action is let's challenge our healthcare systems, public health systems, all the systems that have contributed to some of the inequities we see. Let's tell them to keep that same energy. Put that in the chat. Put that in the chat. Keep that same energy. After COVID dies down, how much money, how much emphasis, how much attention, all this anti-racism action that's going on after George Floyd's murder, after all these COVID inequities, once that dies down, I want people to keep that same energy as we move forward and we challenge and we tackle a lot of the health inequities that we've been raising our voice about for the last several years. Thank you.
Amen to that. Dr. Robinson.
Dr. Jazz, you stole mine, but that's okay. So I'm going to start with keep that same energy. Yes, yes. So for those of us who are here who are representing systems, know that it is our responsibility. The onus is upon us to go above and beyond in repairing or in building trust. It is our responsibility. We carry a bigger burden. People have been working, decrying, pointing out these disparities for all of the last millennium. And it's been our failure to fully address these issues that have created the conditions for what we're facing now. So we either get this right now or we're going to face this again when the next pandemic happens. The second thing I will encourage those of us Black folks who are here, those of us who are working in systems, those of us who are just community members, like I would encourage us to be open, to stay vigilant, but we also have to be open. And so being willing to have conversations, to be willing to talk to people that we trust who have made a slightly different decision on their healthcare than we have had to come to a better understanding of why alternative decisions may have been made. I think that it is going to be a combination of continuing to hold these systems accountable and us doing the hard work of repairing and rebuilding trust, and also for us to be more open and to create some space for grace and understanding so that we can combat these issues together.
Thank you. I'd like to thank again our amazing panel for sharing all this wealth of knowledge with us today. And up next is the Truth Check Reveal with LaTroya Hester.
And while she's doing that, LaTroya is from the Center for Black Health and Equity. She has been, and her agency has been a longtime partner with Jump at the Sun, so we're delighted to have her.
All right, before I get started, first of all, this previous panel was phenomenal. I love the spirit of all of the speakers. The passion by which you guys discuss these issues is just refreshing and encouraging. And I really thank you for sharing. I have lots of family from Milwaukee, but I am from Atlanta, and I am excited to be here representing the Center for Black Health and Equity. And I also wanted to say, before I get started, to all of the Black people on this call, happy Black History Month. You are the hope, you are the dream, you are the legacy of your ancestors, of your grandparents who fought the good fight of faith. And I just want to say, I want to single you all out and say you are magical, you are beautiful, and most importantly, you are powerful and you are capable of carrying forth the work that our folks have established and accomplished up until now. We have much more work to do, but we can do it. Again, my name is LaTroya Hester, and I am the Director of Communications for the Center for Black Health and Equity. I'm going to turn my camera off so that you can focus on the screen. Plus, there's so many people on the call right now. And I am going to introduce to you guys the Truth Check campaign. Our organization, we address health disparities across many different issue areas. Most of you are maybe familiar with our work in tobacco and cancer and HIV, but addressing COVID-19 vaccine hesitancy and information has been an amazing piece of our work that we've taken on, of course, since the pandemic. We've done some state work, and we've also done some work for the National Volunteers. But the way that we are addressing COVID-19 now directly from our organization is really about how we can become more social media savvy. And so I'm going to share this quick little social media spot with you, because we know that misinformation spreads just like the virus has. It is so important for us to recognize how important we are as influencers in the Black community, how people are looking at us when we're posting online, and the fact that when people see the content that we share online, honestly and truthfully, you and I both know, even if you don't trust what you see on social media, you often trust what your mom and them says, what your friends say. And that means that you have to be responsible and astute to know how to discern truthful information from inaccurate information, because a lot of times, like has already been said on this very on this panel, when people see us sharing content, they often make health related choices based on that information. And so what I want to do is talk to you guys about the Truth Check campaign. Later on, I know that Michael is going to share with you all some resources and some ways that you can get involved with the campaign. But what I'm going to do today is I'm actually going to give you the actual course. It's going to be a quick crash course. So hang in there with me, okay, because it's going to go fast. The Truth Check campaign is really an opportunity for you to experience training and get some resources so that you can do the necessary fact checking, so that you can spot misinformation around COVID, and so that you can share accurate information and know when it's accurate as it relates to issues like COVID-19. This is applicable in every direction, but really when it comes to COVID-19, we've got to be really, really careful. And so if you visit our website, thetruthcheck.org, you will be able to access the course, but lucky for you, I'm going to give you the course right now. Are we ready? Now, I can't hear you and I can't see the chat, but I need everybody to participate. I need you guys to be like 100% with me. And I can see, let's see, these are the people who have the biggest responsibility. I'm looking at Edgar and I'm looking at Lorraine. So you guys have got to give me all the faces and all the feedback. Are we ready? All right. Today, I'm not going to be able to give you all the skills that you will learn if you go to thetruthcheck.org and take the course, but I'm going to give you some top line ones that you want to start using right now and that you'll be able to remember. I'm going to talk to you about asking key questions. I want you to start asking these questions that we're going to go over. I want you to start opening more tabs. We'll talk about that lateral reading. And then I want you to keep reading. We'll talk about reading beyond the headline. And I want you to just take your time, pause, think, and don't click on everything that you see. But at the end of this course, if you cannot remember everything that I'm sharing with you, the one most important thing I want you to be able to do is give the side eye. Now, let me just see, whoever has their cameras on, can you give me the side eyes? What does the side eye look like? Show me. You know what, that's right, the side eye. The side eye, for those of you who are not familiar, the side eye is simply a pointed look of suspicion. When you see COVID-19 information online, if it is not directly from a reputable source, I just want you to pause and give it the side eye before we share it. Because remember, we are influencers and folks are looking at what we are sharing, all right? And making decisions based off of that. So if you don't remember anything you learned today, just everybody say out loud, give it the side eye. Give it the side eye. All right, here are some key questions that you can use. Expert fact checkers literally use these same questions. And I don't want you to be that friend in the group chat spreading the fake news. I think that was already said earlier today too. If you want to add a little expertise to your side eye, what you can do is ask 3 key questions. 1, who created this? Who created the message that you're seeing? Remember that there's always an intention. Sometimes there's an agenda, and sometimes it's just there. People are just putting information out there to be funny. But like was also said, a lot of times funny information casts doubt on truthful information. So you want to ask yourself, who created this message? Is this a real doctor? Is this information about like your children's health? Is this from a pediatrician or is it from a podiatrist? Like literally, you need to ask yourself, who created this post? Who is sharing it? You want to ask yourself, what evidence is there? Okay, is it scientific information? Are there multiple studies that back this up? And then you want to ask yourself, what do the other sources say? And you have to be really intentional about those other sources. I'll give you an unrelated example. I went to see Hamilton a couple of months ago, and I was so in love with the whole show, but I walked away really feeling like Hamilton was a strong abolitionist. But when I looked it up online, I realized and remembered that the historians have a different take on that. They have a different take on what actually happened. So what you want to do is ask the same questions when you're on social media. What do the other sources say? And make sure that those are reputable sources. Now let's hop into some skills. After you've asked some of those key questions, I want you to start practicing this thing right here called lateral reading. Now you can see on the screen, I have got an NPR article up. It says new studies find evidence of superhuman immunity to COVID-19 in some individuals. NPR tends to be a reputable source, but even still, what I want you to do is instead of scrolling down on an article, I want you to start opening tabs right away. And I want you to start Googling everything that you're seeing. Google the author, Google the sources that are referenced. I want you to click on all the links that are referenced in the article. And in that way, you're going to be reading across your screen and not only down the screen. That is called lateral reading when you open lots of tabs. All right, the next one is reading beyond the headline. Now, it seems like I shouldn't even have to say this, but we all know that sometimes we see what is often clickbait and we click on it and then we haven't even read the article. Now, sometimes on Twitter, if you haven't read the article and you decide to share it, Twitter will say, hey, hold up, sis, did you actually read this? But in the case that it doesn't, I want you all to embrace this idea that you will read beyond the headline. Make sure that it is not clickbait or make sure that that headline is not misleading. If you look at this headline here in this example, it says Cleveland Clinic study, natural immunity as effective as vaccination. Now, if I just went based off of that headline, I might make some moves based off of this incomplete information. The headline is not enough, my friends. You've got to read the whole article. Because if you click on that article, you will read all kinds of caveats, nuances, deeper explanations of the study, and you will find out that whoever posted this has a headline that is incomplete. So we don't want to be guilty of not even reading the actual article because we did not read beyond the headline. Everybody say, read beyond the headline. Everybody say, give it a side eye. Perfect. Lastly, this is going to take a little group activity. Click restraint. And this is the easiest one, but it's the hardest. In the chat right now, if somebody could just write in www, yes, I said www, clickonthis.com. Somebody put that in the chat. Maybe a few of you will put that in the chat. Now, this is the hard part. Everybody take your hands off the mouse. Remove your fingers from the trackpad. Do not click on that link. Don't do it. Just don't click on that. That, my friends, that little bit of self-control, that is called click restraint. If you can remember to just not click on it, I promise it will result in a reduction of the spread of misinformation, because we know that every time we click on things, you just liking and hearting and sharing and just all that engagement. What that does is it actually boosts the algorithm and makes the platform makers think that this information should be spread further. We don't want to do that. We're right now trying to save our lives. Here's the situation. Here's what I want you to remember. Let me take this off for a second so I can look at you. African-American people, we have saved our own lives by being suspicious. So in our organization, I take it very seriously that the marketing message does not need to be quit being so suspicious. No, I believe very strongly that we have saved our people by being hesitant, by questioning, and we need to continue to do that. But what I want us to do is make sure that as we're questioning, we know where to find that accurate information. We know where to get it from, okay? And we don't want to be responsible for spreading information that isn't true, because our friends and families and our followers are paying attention, all right? All right, so that was actually my note about you and your friends. So make sure that you are a trusted source for your friends and your family and your followers, okay? Now, let's do a quick practice run. Are we ready? Can you spot the real news? Now, this is from a couple of weeks ago. So there's a couple of headlines on here, and we don't have a lot of time to get into it because I was only given a few minutes, but let's take a look at some of these headlines. 1, China creates a fake sun. Next, Flurona is a new strain of COVID-19. Next, man receives a pig heart transplant. And lastly, Alabama wins the National College Football Champion. Go Dogs. It's not that hard to figure that one out. So listen, you right now can, okay, you can use the information that I gave you today, those skills, to actually check on these. If you Google man receives pig heart transplant, I want you to start reading across the tabs. I want you to see what the other evidence says. I am not going to tell you the answers to these, okay? Flurona, is that a new strain? Let's take a look at what the evidence says. Let's ask those questions. Who is saying that? Who's using the phrase Flurona, okay? Let's ask ourselves, how can we start reading those articles across and not down? How can we refrain from clicking on things that just don't sound quite right, okay? I want you to start implementing these skills, because as it relates to COVID-19, remember, folks are making decisions based on what they often see coming from you, their trusted source, all right? All right, if you see misinformation though, here's what you can do, because we're not just gonna sit here and be passive. That is not the legacy of our people. What I want you to do is report it, okay? You can easily Google how to report misinformation online. The World Health Organization has lots of resources for you to use, but here's some quick ones that I can share with you right now. If you see it on, for instance, Facebook, you can click on those 3 dots and there's a button right there and it says, find, support, or report the post. Let's get this stuff cleaned up, because we cannot leave it to Facebook and Twitter and Instagram and all them folks to do the right thing. So we need to start reporting stuff as we see it, because they're really seeking engagement. They're not seeking the greatest good. Let's just be honest. All right, if you see it on Twitter, same thing. Click on the 3 dots and you can do the report, the tweet. You can also go to thetruthcheck.org and download a fact sheet that we have available that'll give you a lot of these same tips. All right, but most importantly, what I shared with you today was only a snippet of what you would learn if you go and take our quick training. It takes you about 15 minutes to get through it, but it is power packed with lots of other skills, other things for you to be thinking about, even more questions that you can ask. It's interactive, there's videos, there's some like little engaging pieces in there. It's a really good, fun, easy to take course. Take it, do it today. It's not gonna take you long. In the meantime, practice your side eye, okay? And I'm gonna leave you with Miss Jennifer Lewis to give you a little inspiration.
Truth check your timeline.
Can you hear that?
Give it a side eye before you share. There's a lot of misinformation. So don't just like you don't care. Read past the headlines and go directly to the source. I went to thetruthcheck.org. I took the course because they're targeting us. There's a lot of fake news. But finding the truth is what I choose. Huh. Finding the truth is what I choose. Finding the truth is what I choose. Finding the truth is what I choose. Just the facts, ma'am.
Thanks, guys.
Thank you, LaTroya. Love it, love it, love it. We're gonna go ahead and move on to Michael, who's gonna give our kind of local call to action.
All right. Thank you, Lorraine. And hello, everybody. LaTroya, thank you so much for that valuable information and for that training. I am looking forward to just seeing everybody get involved with the campaign. And I have some things that I want to share with you today about how you can take action immediately while we're here on this call. So what I'm going to do is I'm going to put something in the chat real quick that I want everyone to take a look at. Now, depending on what your social media platform is, I'm going to give you some posts that are going to help you, help us, help others by sharing the things that I'll put inside the post here. So let me get that for you. I have two posts that are going to be important, two key takeaway messages from today. One of them is read beyond the headlines. So I'm going to put in the chat 3 platforms. We have Facebook, we have Instagram, we have Twitter. Whichever one is your favorite one, there's a link for each one. You can simply click on that link, hit love, hit like, hit share, add a comment. That's going to immediately get that circulating. I'm thankful for the people who have been sharing the videos today. So we are actually been live streaming this whole time onto Facebook. I saw that there were about 18 people who has reshared the stream. So thank you for that. So the first one is read beyond the headlines. If that's a message that's going to resonate with your audience, I want to invite you to go ahead and share that so they have an opportunity to see that. The next one that I'm going to share with you is called the side eye. So let me get the side eye post in here, and then we're going to go ahead and continue on before we close out the program. So let me get those in here for you real quick. Thank you to those who have already been sharing. I appreciate that. So go ahead and pull up that phone or open up your browser, give those posts a share, and that's going to help us make sure that the people who need to see this information can see it. Okay. Also, before we leave today, I want to advise you of a couple of things that are coming up that you can get involved with, again, to help spread the word about the Truth Check campaign and just help us fight the misinformation that's circulating. So one of the events is going to be happening on Friday. That's February 25th. This is going to be a Truth Check event, and that's going to be another Facebook Live event. So I actually posted that on our Facebook page for the Wisconsin African American Tobacco Prevention Network. Again, if you want to know what that is, it's WAATPN on Facebook, WAATPN on Instagram, and WAATPN Talk on Twitter. So those are a couple of action items that we would love for you to do while you're here in this event with us. The next thing that we want to bring to your attention, and we'll be opening up registration later on today, is Fact or Cap. Now, the information that we share today is meant for, primarily most of the people here are adults, professionals who are working in the field. But we also know that it's important for this information to reach a younger audience. So we've partnered, Jump at the Sun has partnered with Empower, with Hip Hop and Health to host an event on March 23rd called Fact or Cap. And that's going to be a game show helped to spread this word and get this message out to that 18 to 40-year-old audience. They're typically getting their health information from social media, so we want to make sure that we have this message translated over to them so that they can take part into the Truth Check campaign as well. So share those posts that I put into the chat. Tune in for the events that are coming up, one Friday, February 25th, and then also the March 23rd. Again, you can always share the post. So we're going to have these on our social media feeds. It would be great if you can just reshare them over to your audience so that they can get to the people who need them. So those are my call to actions for you today. I'm going to turn it back over to Lorraine for our closing remarks.
Thank you. This has been just amazing. I love the speakers, the comments, just the energy. So I want to thank everyone. We need to do this again. We know that Black History Month is year round. And so I'll just close with the remarks made by Ida Bell Wells, who said, "The way to right wrongs is to turn the light of truth upon them." And that's what we did today. People talked about, they shared rich information. You ended up getting information on how to even truth check. So again, I just want to thank everyone. We look forward to seeing you at our March 23rd event. And with that said, I'm going to sign off. We actually ended a little bit early. I'm surprised, but thank you. Thank you. This was very, very inspiring for us, and we were honored to be able to offer it. And again, thank all the speakers and my team for making this happen. So can we kind of, since we have a little bit of time, can we hear Sister Strings again as we sign off, if you don't mind?
Yeah, I'll get that ready for us to play out. Thanks for coming,
Great.
everyone.
Thank you all.
Let every voice and sing till earth and heaven rings with the harmonies of liberty. Let our rejoicing rise high as the listening skies. Let it resound loud as the rolling sea. Sing a song full of the faith that the dark past has taught us. Sing a song full of the hope that the present has brought us. Facing the rising sun of a new day begun. Let us march on till victory is won. Stony the road we tried, bitter the chastening ride, felt in the days when hope unborn had died, but yet with a steady beat, have not our weary feet come to the place for which our Father sighed. And we have come over a way that with tears have been watered, and we